Hey there, Dr. Norris, owner of Koru Chiropractic Corrective Care, and today I want to talk to you about the Atlas Subluxation Complex, or the ASC. The ASC can cause a wide variety of health problems, not just headaches and neck pain, but many issues. And today I have this special 3D model here to show me and you how these issues are connected and how it can really plague the whole entire body. So one of the big issues is when you have a misalignment of the atlas bone, and this is really showing normal anatomy, so it doesn't really represent what is happening when you have that misalignment. But one thing that's going to affect right off the bat is your vertebral artery blood flow, okay? So I see a lot of problems with that, with brainstem issues, because that's where your exclusive blood supply to the brainstem is. So that's where we see, things like headaches, but even more severely and complex are migraines and vestibular issues. So things like vertigo, dizziness, and even Meniere's disease. This can cause, with Meniere's in particular, not just dizziness, but a fullness of the ear, a tinnitus sound, and potentially even hear loss. So with the Atlas Subluxation Complex, as you can see, there's a lot of head issues, right? But it can also cause lower body issues because there's a huge shift to one's posture when they have one of these misalignments. Not only does the head and neck not conjoin perfectly the way we expect it to, straight up and down, level, right? We always want our eyes to be level, our ears are level, and our neck should be right over our thorax. But sometimes when you have an Atlas Subluxation Complex, either your head will bend to one side or your lower neck will bend over to a side. And because of the weight of the head at 10 to 12 pounds, your body has to adapt. You're not going to walk around like this very long. That's going to cause neurological issues. You're not going to walk around like that very long because that's going to cause a lot of compression of the facet joints, maybe even disc bulging. And so what happens is your body compensates. It starts to twist and shift and compensate the way that it's designed to help protect it. But these protections are beneficial in the short term, but long term, many other health issues start to come up. So some indications of this, quite honestly, are pretty easy to see. A lot of times you'll see an uneven fold in the torso right around the love handles. So maybe one side is more defined than the other. The hips will be unlevel, the shoulders will be unlevel. Sometimes you can notice the ears may even be unlevel, and you'll oftentimes, when you ask someone to look straight at you, you'll notice that they'll have a head rotated to one side or the other. So you'll see more of the space between the eye and the sideburn hairline here and ear. There'll be more skin on one side than the other, right? So these are some clues that I look for to identify if someone has an Atlas Subluxation Complex or ASC. And then really with the technique that I do with NUCA, we have to actually go in and measure what the misalignment is and how to then biomechanically best correct it, right? Because we use a very gentle and specific adjustment. There's no twisting, cracking, popping. We use a very gentle, almost pressure adjustment to just nudge it or glide it back into place. And what we see is that in just even a single adjustment, things will straighten up. And then if the body can hold that or accept that new position, and really your normal position versus your compensated position, if we can get you to keep and maintain the normal position, we'll find a lot of restored neurological function because of the more optimal blood flow, the more optimal venous flow. You can see the carotid artery goes right in front of the atlas bone. Also, the jugular vein comes down right in front, as well as the vagus nerve. So if you have a big rotation of your atlas bone, that can create a plethora of health conditions that most people, including most doctors, will quite honestly not associate with a misalignment of the neck. But one clue that I often find, and probably the most common story I hear from patients is, doc, I've been struggling with this for, whether it's weeks or months or sometimes even years and decades. I've had all the tests done. They've scanned my brain. They've looked at my neck. They've looked at my ears. They've looked at my eyes. No one has given me a solution other than just try a medication. Maybe it'll work. They don't really know the etiology or the causation of the pathology or of the symptomatology, okay? And to me, that's like the perfect upper cervical case because 99 times of 100, when we analyze their posture, we're going to see that there's a huge postural distortion or postural compensation that's going on. And then when we image their upper neck, we're going to see a misalignment, something that, unless you're an upper cervical specific chiropractor, you're not really looking and measuring. And then again, with a very gentle and specific adjustment, we can get it back into place and then allow your body to start restoring and healing from there. So it's a complicated issue. It's an underserved issue. Quite honestly, a lot of chiropractors are not even addressing this to the right capacity. And if you've had a lot of unsolved health conditions and maybe even have a intuition that these are related to your spine, or you just know, hey, I've got all these other health ailments, but I also have some neck and back pain, we'd love to do a consultation with you, figure out what the root cause of the issue is, and if it's related to your spine, you're in the right place and we'll help you out.